Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider.
Breastfeeding Introduction. Breastfeeding or nursing can be an easy and low-cost way for a mother to feed her newborn. Women who do not have health problems should breastfeed their babies for at least the first 6 months of life. In fact, it is best for women to try to breastfeed for the first 12 months of their baby's lives because of the benefits to both the mother and baby. This program explains the benefits of breastfeeding, as well as how to breastfeed and how to care for yourself while doing so. It also discusses situations when it is best not to breastfeed. Why breastfeed? Breastfeeding benefits your baby in a lot of ways. Breast milk has a lot of nutrients in it that will help your baby grow into a healthy and strong toddler. Breast milk contains antibodies, which are special substances that help fight infections. This is why breast milk helps prevent your baby from getting sick with diarrhea, ear infections, lung infections, and allergies. In fact, among babies who are fed breast milk, there are fewer deaths and fewer illnesses than in babies who are fed formula. Recent research suggests that breast milk has important fatty acids in it that help your baby's brain develop, especially by increasing cognitive skills. Cognitive skills include perception, memory, concentration, and logical thinking. Breastfeeding also benefits you. Your body releases a hormone in response to your baby's sucking that helps your uterus contract and go back to its normal size after pregnancy. A lot of mothers enjoy emotional benefits from breastfeeding. It is a time for close interaction between you and your baby. It also gives you the satisfaction of knowing you're nourishing your baby. In fact, research suggests that mothers who breastfeed have fewer episodes of postpartum depression. Breastfeeding is simple and clean. There are no bottles to wash or formula to mix. It's also cheaper since you do not have to buy the formula. Breastfeeding. Even though breastfeeding is a natural process, it's not always easy. You can work with a lactation counselor, also called a lactation specialist, to learn how to breastfeed and what is involved with breastfeeding. This section gives you a general idea of how to get started and how to hold your baby while breastfeeding. You can hold your baby several different ways to breastfeed. The main concern is that your baby should not have to turn or strain in order to nurse. One way to hold your baby is called the cradle position. Lay your baby sideways facing you and your breast. Your baby's head should be resting where your arm bends. Cradle your baby in your arm, grasping his or her bottom. Another way to hold your baby is called the football position. Tuck your baby under your arm like you would a football. Your baby's head should be resting in your hand. Your forearm should support your baby's body. If you have a very small baby or are recovering from a C-section, this position may work well for you. Also, you can feed your baby while lying on your side. For this position, lie on your side and make sure your baby is facing you. Use pillows if you need to support your head and shoulders. If you are recovering from a C-section, this position may work well for you. After you have your baby in the correct position, use your free hand to place your thumb on top of your breast. Your baby's lips need to be on the dark skin around your nipple, called the areola, so do not touch it. Touch your nipple to your baby's lips until your baby opens his or her mouth wide. Put your nipple all the way into his or her mouth. Hold your baby close to you. Your baby's jaw will start to squeeze the milk ducts that are under your areola. Your baby's lips will pout out and cover almost all of the areola when his or her mouth is positioned correctly for feeding. Your baby's lips should not be pulled back over his or her gums. You should hear swallowing noises that are low-pitched coming from your baby. If you hear smacking noises or feel pain while feeding your baby, his or her mouth may not be latched on the correct way. Babies have special noses that are designed to let air get in and out if pressed against your breast during nursing. If you think your baby is having difficulty breathing, you can always press down on your breast where your baby's nose is touching. This will give your baby more room to breathe freely. After you start a breastfeeding, your breast may start to tingle. This usually happens a few seconds to a few minutes after you start breastfeeding. You may notice that milk is dripping from the breast that is not being used. This means that your milk is ready to come out and flow. This is also called the let-down reflex. When your milk is flowing, it is easier for your baby to feed. Sometimes, you may notice that this happens if you go too long without feeding your baby, hear your baby, or sometimes even think about your baby. When the milk begins to flow, your baby may cough. You can avoid this by gently squeezing some of the milk out by hand before feeding your baby. This will cause the letdown reflex to happen before your baby is feeding.
Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials.
How often? Feed your baby as many times as he or she wants to be fed. This could be 8 to 12 times a day or even more. As your baby grows, the number of times he or she wants to be fed will probably change. Growth spurts happen around 2 and 6 weeks of age and around 3 and 6 months of age. Let your baby nurse until he or she is finished. This generally is about 15 to 20 minutes for each breast. You should try and have your baby feed from both breasts at every feeding. You need to make sure your baby is getting enough milk. If your baby is feeding less than 8 times a day, make sure to look for the following signs. These signs can let you know if there is a problem. Some of the signs that your baby is not getting enough milk are: your baby is unsatisfied after feeding, your baby is not gaining weight, your baby has less than 6 to 8 wet diapers a day, your baby seems tired or sleepy all the time. If you think your baby is not feeding enough, call your doctor. Do not give your baby formula or cereal. If you feed your baby formula, he or she will not take as much milk from breastfeeding. This will cause your body to decrease the amount of milk it creates. Babies should not eat solid foods like cereal until they are at least 4 to 6 months old. Sore nipples. You can prevent your nipples from becoming sore in most cases. Usually, sore nipples are caused by the baby not latching on to your breast correctly. If your baby's mouth is not correctly latched on, you can start over. To start over, place your finger on the corner of your baby's mouth near the gums. This will release the suction on your breast. If your nipples are sore, do not decrease the amount of times you feed your baby. This can cause leftover milk to stay in the breast glands. If the milk ducts do not empty out, your breast may swell and be painful. You can use ice to soothe your nipples before nursing if you need to. Some mothers use lotion on their nipples to soothe sore nipples. If you do this, make sure to clean it off before feeding your baby. Make sure to call your doctor if you have painful, swollen breasts, any red painful spots on your breast, or if you have a fever. These could be signs of an infection. Mother's diet. Make sure to eat a well-balanced diet that has a lot of calcium and drink a lot of fluids. Eat a variety of foods including vegetables, fruits, grains and breads, meat or beans, and milk and other dairy like cheese. Make sure to get about 500 more calories a day than you normally would. To get enough calcium, try and eat about 5 servings of milk or dairy items every day. You can also get the calcium you need from other foods like broccoli, tofu, kale, and sesame seeds if you do not eat dairy or meat products. What you eat and drink can get into your milk. Make sure to limit how much caffeine and alcohol you drink. The medications you take may get into your milk, even if they are over the counter. Make sure to talk to your doctor about any prescription or over-the-counter medications you are taking before feeding your baby. If you smoke, the chemicals from the cigarettes can get into your milk. It can also cause you to make less milk. Nursing your baby is a great opportunity to try and quit smoking. When to not breastfeed. In some cases, your doctor may tell you not to breastfeed your baby. There are many different reasons that it may be better not to breastfeed your baby. This section discusses some of these reasons. If you have certain health conditions, like HIV or tuberculosis, you should not breastfeed. You could pass these infections to your baby through your milk. If you use drugs or drink a lot or have done this in the past, your doctor may suggest not breastfeeding. If you are on certain medications that may be harmful to your baby, you should not breastfeed. Some medications can pass through your milk and harm your baby. If you have a chronic illness, your doctor may help you with special instructions on how to stay healthy while breastfeeding. Sometimes, depending on the illness, your doctor may ask you to not breastfeed. If you have had surgery on your breast earlier, you may have difficulties feeding your baby. Sometimes in these cases, it is better not to breastfeed. Always talk with your doctor before changing or stopping breastfeeding. If you do stop breastfeeding before your baby is a year old, you will need to feed your baby an iron-fortified formula. You should not give your baby cow's milk until your child is at least a year old.
If you like this video, please like and share. For similar videos, subscribe to our channel.
Conclusion. Breastfeeding is a great, healthy, affordable way to feed your baby in the first year of his or her life. Many health centers, clinics, and hospitals have lactation counselors on staff. Ask your healthcare provider for more information about getting help with breastfeeding. Even with help, some women still have trouble breastfeeding or cannot breastfeed. Talk with your healthcare provider about breastfeeding your baby. Breastfeeding can give you and your baby important bonding time and make your time with your baby more enjoyable.
Thank you for using Explain.